Chris Williams. I am an internal medicine physician at Purveyor Health, and I have played in the Civic Symphony of Green Bay. I think this would be my 16th year, 15th year, and I play violin, as you can probably see from one of my masks I've got. And music's a big part of my life. It's outside of my job and my family, music's the next big thing. And I consider the people in the Civic Symphony as being my friends and family, and really missing them in these times. So really looking forward to getting back together here in the next 6 months or so and making some music. This is my office, and it could show you one of my exam rooms too, show you where I do my work. So, another one of my loves is puzzles. That's what I do to calm myself down after I get home from work. And then play a little bit of violin here and there. So this is one of my exam rooms. It's just right across the hall from my office. And I have another exam room across the hall from here to the right. And then there's some other bigger ones if we need to do more involved exams. But one of our nurses will come in, CMA or LPN will come in and room the patient and get their vital signs and find out what they're coming in for. Check their medications. That's one of the most important things, to make sure they're on the right, we have the right list of things they're on. And then they'll put a flag up saying it's time for me to come in and see the patient. And prior to that, I will have looked at their chart and kind of made my own mind up about what we're going to do with this visit and try to answer their questions. So first of all, you ask them questions. I will go through history and things like that and their medications and see if they're having problems with certain areas and see what their needs are that day. After kind of doing an interview and that part, that's the history part of the history and physical, I'll come up and we'll do an exam. If we're doing a physical, I'll usually look in their ears and look in their eyes and their mouth and that type of thing. Then I'll take a listen to them with my stethoscope, have them take deep breaths, and I'll make sure their heart's beating right, and listen to their neck, make sure they don't have any blockages in their arteries there, and listen to their belly and check that out, and move down to the legs and just check and make sure they don't have a bunch of swelling, and make sure that if there's any neurologic problems or skin problems, we address those. And then I'll have them come sit back down and we'll kind of go over things again, and I will, on the computer here, and we'll kind of basically decide if they need new medications, they need new procedures, and if they need a referral to another provider. And then we'll kind of finish the visit, and the nurse will come in and get them checked out and get them to the lab if we need to. And I'll call them later about the labs if we haven't already done them before that. So one of the exciting things is we're going to be moving to a new building just down the street, about 2 blocks away from St. Mary's. It's brand new and 4 stories and gorgeous, and all the subspecialists are going to be over there, including cardiology, who's across the street now, and the colorectal surgeons who are across town now. They're going to all be in the same building. So it's going to be pretty exciting. Looking forward to it. And so I'm here 4 days a week. Thursday's my day off, and I get ready to play orchestra music that night on Thursday. That's always a big night of the week. So just love it. Love Civic Symphony.
Hi, my name is Dr. Amy Jakubovsky. I'm a chiropractor here in Deep Here, Wisconsin. I'm an essential worker, and this is my practice. Let's go on inside. Bend this leg. Let's bend this one. I won't drop you, I swear.
Yeah. She has, yeah.
Good job. Good job. All right. Let's roll this side. Good job. Okay. Let's check out what's going on here. Where's Mom?
Whoa. Woohoo! Nice one. Nice.
Good job. Smiles all around, right? I have been a member of the Green Bay Symphony for nearly 40 years. I started in the early 80s in my high school years under the direction of Miroslav Pansky, and now under the direction of Song Graham. I have been a chiropractor for 25 years. I started in 1996 to present here in Deep Here, Wisconsin. This is my lobby where people wait. We have the hallway. Back in this section, I have 2 massage therapists that have their separate rooms back there. This is my treatment room where I do all my work. I have my wall, which instead of the wall of Technicolor Dream Code, it's the Technicolor Wall of Dreams. I have my DePaul School of Music with Performance and Suzuki Emphasis up here. Various continuing education and myofascial work, chiropractic work, my degree from Parker College of Chiropractic, as well as other state certifications. This is my adjusting table, my gorgeous view out the window that I get to look at day in and day out while I work on every one of my valued patients that come through this door. I enjoy being an essential worker. I enjoy immensely playing with the Green Bay Civic Symphony. And even though it may be dark right now and we are not able to play, very soon we will be back on that stage and making music. And I am so looking forward to doing both things that I enjoy and love so much, practicing chiropractic and playing music with the Civic Symphony.
Hey everybody, Dr. Bill Kasper here, coming from my office at St. Elizabeth's Hospital in Appleton, Wisconsin. Now that I've taken my mask off, you might recognize me as one of the cellists in the Civic Symphony of Green Bay. I've had the unique privilege of playing in the cello section of the symphony now since the fall of 2008. Playing in the symphony has been a great pleasure for me. It's my weekly music therapy during the orchestra season, and I've really missed it during this year of social distancing because of the pandemic. But hopefully things are turning around now, and we'll be back out there in the fall. So for my day job, I'm a pediatrician. So I'm part of the pediatric hospital team here at St. Elizabeth's Hospital. So what does that mean? So a pediatric hospital team is a group of pediatricians that provide 24 hours, 7 days a week, in-house coverage for our infants and children here at St. Elizabeth's. So that's kind of, in a nutshell, what my day job is. I think what I'll do now is maybe take you on just a little brief walking tour of the areas here at the hospital where I work. Here I am again. So we're walking down the hall to labor and delivery. So this is the hall I often am running down in order to get to a delivery on time when they call me if I'm needed. And I think they're just getting ready for something big here, so we'll just say hi really quick. So here we are at labor and delivery, and here's the crew. They're getting ready for a big delivery, so we won't bother them for too long. And I know they'll do a tremendous job. All right, we'll see you later. Bye. So now we're headed back towards the nursery. We'll be walking right by the newborn intensive care. So here's our newborn intensive care unit. That's where we take care of all our preterm infants and any of our term infants that might be having any issues. And here we are at the regular nursery, where we do most of our normal newborn care. We try as much as possible to keep our newborns actually in the rooms with their moms, because that's the best thing to do. So last but not least is our pediatric unit, which is where we take care of our children and adolescents. Fun fact, during the COVID epidemic, our pediatric unit has actually been used more for overflow for sick adults, as we've had a lot more sick adults than sick children during the epidemic. So here we are at our pediatric unit. That's our playroom over there. Important to have a playroom for children. And here at the work desk is my faithful partner, Dr. Lynn Kohlmeyer, who is actually working today while I'm doing all the camera work. So how's it going, Dr. Kohlmeyer?
Not too bad.
Good. Having a good day?
Yes, having a good day.
I understand a big delivery coming up, because I was just down at labor and delivery, so best of luck with that.
Thank you.
All right.
Have a good day.
All right, we'll see you later.
Bye-bye.
So that about wraps up my brief walking tour. I hope you enjoyed finding out a little bit more about what I do as a day job. And I know the people in the orchestra come from every walk of life, and I know we have a couple other people in the medical profession as well. So mask up, stop the spread, and hopefully we'll be able to get back together in the fall. Bye for now.
Hi, my name is Amanda Barnes and I play violin for the Civic Symphony of Green Bay. For my work, I am a physician assistant and I practice at the Theta Care Urgent Care, working alongside physician assistants, nurse practitioners, physicians, and other medical staff to evaluate patients and provide acute care to patients. I joined the symphony for a love of music and coming together with other musicians to be part of a symphony and give back to the community. And some interesting things about me, I am from Virginia, and I love spending time with my family, and in my free time I love traveling, running, spending time with my dog, and gardening.